The Ministry of Education must ensure that cancer awareness is integrated into our school curricula and life skills programs. The Ministry of Agriculture and Livestock Development, as well as the Ministry of Investments, Trade and Industry, must regulate this one is a big one. Carcinogenic products which promote health and nutrition and ensure food safety. The Ministry of Environment and Forestry must address environmental risk factors such as pollution and hazardous exposure. The Ministry of Information and Communications and the Digital Economy must support cancer registries, telemedicine, and digital patient care platforms. The National Treasury and Planning must prioritize and sustainably fund cancer prevention and treatment programs. The Ministry of Roads and Transport must ensure improved networks to make it easier for Kenyans to reach screening, diagnostic, and cancer treatment centers, and the list goes on. And crucially, county governments under devolved healthcare must localize, fund, and lead community-level interventions. In short, we must embrace a whole-of-government and a whole-of-society approach. We must bring all hands on deck, including the healthcare workforce, pharmaceutical companies, civil society, the private sector, academic institutions, faith leaders, media houses, communities, and above all, cancer survivors and caregivers. As a government, we recognize that cancer is a borderless crisis that requires borderless cooperation. That is why we have reaffirmed our role in international cancer diplomacy by participating in global cancer summits and World Health Assemblies, strengthening our voice in regional economic blocs to prioritize cancer under trade, health, and human capital development, hosting South-to-South collaborations for oncology, training, and knowledge exchange, and aligning our policies with UN and WHO global cancer targets, including the target to reduce premature mortality from non-communicable diseases by 1/3 by 2030. We are determined to position Kenya as a credible, responsible, and proactive partner in global cancer control. We shall collaborate with international organizations and other industry players in cancer care, in research, innovations, and in developing new health products and technologies. We are ready to learn, ready to lead, and ready to leverage on our networks to serve our people and the region better. We are not merely responding to disease. We are building the infrastructure systems and workforce that can anchor medical tourism, regional referrals, and clinical trials within Kenya. Our ambition is clear: to serve not just Kenyans, but also our Eastern and Central African neighbors who seek accessible, affordable, and high-quality cancer care. This ambition cannot be achieved in isolation. The government of Kenya, through my office, has prioritized health diplomacy as a cornerstone of our external relations. Through bilateral and multilateral partnerships, we are engaging meaningfully with international organizations and cancer control bodies, including the World Health Organization, the International Atomic Energy Agency, and Professor here spoke to it, the Union for International Cancer Control, and numerous UN agencies, regional blocs, and philanthropic institutions.
Cancer, as many of you may know, is now the third leading cause of death in our country, following infectious and cardiovascular diseases. we are facing a rising tide. Over 58,000 new cases annually, projected to increase to 95,000 by the year 2040. The time for dialogue is now, but more crucially, the time for action is now. Today I want to speak to one central issue: how we move from policy to practice, from paper to patient, from intent to impact. And I speak both as a governor and as someone who has walked this journey from national policy calls to county hospitals, from boardroom consultations to community health units. During my time as Minister for Medical Services, I initiated a process that eventually led to the establishment of the National Cancer Institute of Kenya, of which a lot has been said today. Today, I stand proud of what it has become, a national institution anchoring our cancer response. Equally, I celebrate the opening of public cancer treatment centers beyond Kenyatta National Hospital, beginning with Kenyatta University Teaching, Referral, and Research Hospital, and now extending to 5 additional regional centers. What is happening at Kenyatta University Teaching and Research Hospital is really magnanimous.
Data is our compass. Our National Cancer Surveillance Platform is enabling real-time data to drive smarter, targeted decision-making. On prevention, the ministry has successfully integrated the HPV vaccine into our routine immunization schedule, targeting adolescent girls aged between 9 and 14 years. This is a momentum step towards the elimination of cervical cancer. We are expanding our community-based screening for breast, cervical, prostate, among other cancers, through community health promoters and mobile outreach teams. Early detection saves lives. We are also strengthening our referral system to ensure timely follow-up and care. No Kenyan should suffer or die because of delayed treatment.
Your Excellency, we from the State Department of Medical Services are very keen on 2 areas. As we discuss the general country policy around cancer, we are keen on making sure that hospitals perform the functions well in terms of clinical workflows, so that cancer patients are not tossed from one side to another. There's a very clear pathway how they get into the facility, how they get their care, and how they get out. And secondly, sir, is we are also ensuring that we match the resources with the policy so that we get efficiency in terms of resource deployment.
I'm charged with the care of over 60,000 inmates in Kenya across 135 prisons. And one of the biggest problems we are grappling with is cancer, particularly prostate cancer and to a very small extent, breast cancer. Why do I say to a small extent? The reason is because 95% of all our inmates are men. And the bills that we have accrued in that space are astronomical. And I'm very happy that you have this summit. And I would urge all the delegates and participants in this meeting that when you're deliberating on the issues of solving, particularly prevention, diagnosis, and palliative care of cancer patients, kindly consider to come into the space of correctional services.
I'm pleased to inform you, Your Excellency, that we are working closely to have digital screening tools, and as you've seen outside, the use of the AI so that we can be able to interpret the data from the radiology and the rest. But the elephant in the room is on capacity building. We have to continue training our people. And I'm pleased to let you know, Your Excellency, that my work at the IEA still continues while I'm here to help the country. We are looking at Kenyatta University Teaching Referral Hospital Cabinet Secretary, and I have made recommendations that it becomes the centers of excellence so that we can be able to train Kenyans and Africans. And also looking at the strategic collaboration, public-private partnership is very critical. One thing that, Excellency, I would like to mention here, according to standards, we're supposed to have 1 machine per million population. Kenya at the moment is standing at about 19 machines. So we have a deficit of about 36 machines. If you do a rough estimate, that will cost us about 90 billion Kenya shillings just to procure the linear accelerator.
If you look at the burden of cancer in this country, you know, the CEO, Dr. Meli, has talked about the numbers. We know the numbers. I don't have to recite those. It is significant. And this is not only in Kenya, it's across the continent of Africa. The one thing we must ask ourselves is it affordable to actually provide good, equitable, accessible care to that burden? The Kenya government is doing a whole lot, and we must thank the government for the efforts that have been mentioned here by those who have had, you know, this burden, have suffered this burden. But when you look at the fiscal space, the available money, and you look at our structure of health financing, we would need about $1 billion, Cabinet Secretary, in my view, and PCS, to actually take care of everyone who needs to be taken care of, the screening, the prevention, and the care and treatment needed at our current burden. I would estimate that at about $1 billion. That's about more than 100 billion shillings, which is close to a quarter of our health expenditure generally, which is unaffordable in a country whose GDP and population and the tax collection is as it is right now. We have to face the reality that the fiscal space is low. And also knowing that the donors, and I talked about this in the first summit, the donors do not support the non-communicable disease sector, largely because most of the donor aid that we know that's now declining is actually driven by what we call global health security. It is the disease you have, let me keep it away from my people. That's really what drives the global health security. Of course, we have partners who've stuck with us, and that's the private sector in this area, and we thank them. But we know that the development assistance in the multilateral structure is guided by global health security. So the cancer care of hypertension and diabetes is a national agenda.
Through the National Equipment Service Project, we are strengthening our cancer care by equipping our national and county referral hospitals with essential screening and treatment equipment. Mammograms have already been installed in Kisumu and Kerugoya, while CT scans are operational in 15 county referral hospitals, with installation underway in another 15 additional counties.
Let me say that to ensure that policy translates into impact, counties must operationalize the national strategies pillars, from prevention and screening to diagnostics, treatment and palliative care at every level of the health system. 2, stakeholder coordination must be institutionalized. National government, ministries, county departments, healthcare workers, NGOs, community health volunteers, and development partners must align on plans, funding, and messages. 3, community engagement and demand creation, as we have done in Kisumu, must be at the center, because the greatest interventions fail if people do not trust or understand them. 4, we must invest in surveillance, training, research infrastructure, including national reference laboratory and robust data systems. 5, and lastly, and critically, we must scale up financing mechanisms, including public-private partnerships, domestic resource mobilization, and risk pooling through insurance to cushion Kenyans from catastrophic health expenditure.
Cancer is a growing national and global challenge. It continues to exert a profound toll on the lives of Kenyans and health systems. The burden of cancer is not just medical, it is economic, social, emotional, and psychological. For this reason, we must approach cancer not as a health issue alone, but as a national development priority that requires a multi-sectoral and multi-stakeholder approach. If we are to meaningfully address cancer, then all sectors, not just the health sector, must come on board. We must embrace a multi-sectoral national response to cancer. We must break down silos. The Ministry of Education must ensure that cancer awareness is integrated into our school curricula and life skills programs. The Ministry of Agriculture and Livestock Development, as well as the Ministry of Investments, Trade and Industry, must regulate carcinogenicity. Wow, this one is a big one. Today we stand united, not just in sorrow, but in our resolve to turn the tide against cancer. We are not powerless. We are powerful when we join hands, when we unite our voices, and when we act with purpose. Every Kenyan has a role in this battle. Whether you shape policies, heal patients, educate minds, grow food, or inspire the next generation, your actions matter. Your voice matters. Let us leave this summit not with words alone, but with a commitment to bold, measurable steps towards a cancer-free Kenya. Let us honor those who have lost by ensuring their pain is not the legacy of our future. May we draw strength from our unity, courage from our convictions, and hope from our shared humanity. Together, we can and we will defeat cancer.